Kyle, thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we welcome Shandon Fowler, who is the founder of Four8 Insights. And Shandon has an incredible wealth of experience about the ACA marketplaces, and he's going to talk to us today about basically all things related to the ACA marketplace, what it's like, what the enrollment, what we can look forward to with the first Biden OE, what we experienced with the special enrollment periods over the last year dealing with COVID, how this might impact employer plans. So we have so much to talk about. Thanks so much for being here, Shan.
Thank you so much. It's great to be here. I really appreciate the invitation.
I'm so excited to talk about this because it's stuff that everybody needs to know about, whether they realize they do or not. So why don't you tell us what are some of the most important things that people need to know right now?
I think the first and foremost is that open enrollment starts on October 1st. That's open enrollment for the ACA marketplaces. It's actually going to, over the past couple of years, it's run through December 15th. I think that, and then there are certain states that run it longer than that. But in order to be eligible for coverage on January 1st, it's good to be enrolled in a plan by December 15th. Now, I think that the Biden administration has actually extended it for this year.
You told us a number in the pre-interview that there were 12 million people who have gone through this already. Is that the special enrollment?
Actually, the special enrollment was 2 million people. So this year, a lot of the year was a special enrollment period. And there were a number of reasons for that. The first and foremost was because of COVID and the pandemic and people losing their coverage by, losing their jobs, essentially. And so 2 million people, which is a huge number for special enrollment, have been able to get coverage through the marketplaces, both state-based exchanges and healthcare.gov and the sort of third-party marketplaces that provide that as well. I think that in addition to that, one key that is, or two keys that are really interesting about that are, the first is that if you've been unemployed even for a month or I believe even for a week during the year of 2021, you can essentially enroll in what's called a silver plan and get it free of charge. The subsidy that is provided through the ACA gets you a silver plan for essentially no money. So there are a lot of people that started in July, or I believe it became eligible back in the spring, but that people could start enrolling in that and getting that subsidy in July. And if
How do they know about that?
Well, various methods. I think mostly you have to kind of be looking out for it. Some employers, if they are, laying you off or letting you go, they might tell you about the public exchanges and the availability of that. Doesn't happen a lot. But the good news on that is that if you were unemployed and then you ended up getting, coverage and you didn't know about it, it's a subsidy, and you'll get a refund at tax time. So, that's nice as well. And then the other thing is that the last year's open enrollment was actually 5% larger than the year before, which was a lot larger than the year before that. So the public exchanges, the total number was 12 million, as you said, or actually north of 12 million. And it was really, obviously the numbers were going to go up, but it was really a stabilizer. A lot of us who have been policy experts in this area, we kept telling ourselves well, if something happens, if the market shifts again, we were thinking of another Great Recession, then the ACA is a safety net program that will work to help keep people covered that lose their coverage through an employer. And it wasn't a Great Recession, but that's exactly what happened with the pandemic, is that a lot of coverage, both through the individual marketplaces and the ACA subsidies that you can get there, and also through Medicaid expansion in the states, which is part of the ACA as well, has done a good job of keeping people covered during this, extremely tumultuous time. So yeah, it's a lot going on. I think where I came into this, you mentioned that I've been sort of a part of this. So I've been an ACA expert for, 10 years. Well, I guess 11 or 12 years. But I had never, up until about 2017, I'd never had ACA coverage because I always worked for a large employer that provided coverage for me. When I became an independent consultant, I went out and I said, okay, now it's my chance to get ACA coverage. And so I got it, and, it was all right. It wasn't, sort of as rich as my employer coverage, but the rates were decent. They at least, was at least not getting, having to get a second mortgage on my house to get my coverage. With the American Rescue Plan Act, they actually extended the subsidy structure so that essentially you sort of tapped out at 400% of income before the American Rescue Plan Act. So your ability to get subsidized ACA coverage tapped you out at that income level. But now any income level can essentially get a subsidy based on their income. It's really confusing. I don't want to get into the details, but the point of it is that, somebody who is of, moderate to high income could get coverage at a, relatively low rate. My example, which I wrote about on LinkedIn, and then it got covered in the Wall Street Journal, sort of got picked up in the Wall Street Journal, is that when I went back to being a private consultant this year, my coverage, because of the ARPA, went from about $300 to about $55 per month. So that was pretty incredible. I think it'll go up as my income goes up, but it still won't be, $1,500, $2,500 like, it might be under, without the, ARPA. So lots of activity in this space. And as you said, it's kind of tough to get information. So it's good to sort of talk to everybody about this kind of thing.
A lot of moving parts, Shan. I think you've done a great job of laying out, the challenges that have been going on. And what I find fascinating is that you said that with the pandemic, you're seeing some further shifts because of the changes in how people are employed. Could you talk a little bit more about the changes you're seeing there?
Yeah, sure. There are a number there. So, for a long time, I think that again, I'm sort of a strategist by trade. So, that means that I kind of get my crystal ball out, every now and then. And I think that what a lot of us talked about was, okay, is the ACA going to displace employer-based coverage? And there was reason to believe that it would. And in fact, in our business, the sort of benefits technology business that I came from, there was a report put out by McKinsey in 2011 that said that up to a third of employees would actually drop coverage to employers because it would be cheaper for them to send them to the exchange. Now, it was a really rational piece, but a lot of irrationality has sort of built up and calcified in the employer-based benefits, profession over the past almost really close to a century now. And so it didn't come to pass. The economy picked up and benefits became a really important sort of bargaining chip for recruitment and retention. And so we thought, well, maybe the ACA will sort of pick up, if something happens, if there's another downturn. And, it's unfortunate that we got the downturn that we did with the pandemic, but you're really starting to see some of this calcification really kind of break up and loosen, where employers are looking at this and thinking, well, maybe things are better. There were 12 million people enrolled over the past year. Plans are better. I mean, I'm proof that, there are actually plans that can support a family. People are paying very little, on the public exchanges. That's one thing that is surprising to me that doesn't get covered a lot. When you see, outlets talk about the rate increases and that, this plan is going to cost $2,500 for this year or $1,500. What they don't tell you is that 90% of people, because of their subsidy eligibility, are not paying any more than $50 per month for those plans. So there's a deeper debate about, well, who's actually paying for it? It's got to be paid at some point. But the bottom line is that the individual market is stabilizing to a point that employers can now kind of look at it and say, well, maybe this is better. An example that I'll give you, a quick example I'll give you, is that in the state of Colorado, they recently, their rates for 2022 were just announced. And the individual rate increase for the year was 1.5, 1.4%, something like that. The group rate, small group rate increase was 4.5%. So there you have a state where now, don't know what the sort of median cost of a plan is, but the rate increases are slowing in the individual market more than they are in the group market. So if you're a group and you're paying all this money to insure your employees, and then you have probably a handful of employees who are like, well, wait a minute, there's this other thing out there, and I can actually do a lot better than what you're doing, especially families, then why not do it? And that's probably going to be key to shifting this idea that employers have to be a component of the U.S. healthcare system, that has lived for, like I said, almost a century.
You're starting to see that happen then, Shan? Is that what you're saying? You're starting to see some calcifications breaking down?
Yeah, I think so. And two quick examples. So there was something that was enacted under the Trump administration called an ICHRA, an individual. Let me make sure I get this right. I always mix up the individual coverage health reimbursement arrangement. And basically what it says is that it's almost like, you can kind of think of it as a 401k, where your employer gives you money, a defined contribution that you can then take and spend on individual health insurance. So your employer gives you, let's say, $500 a month or $1,000 a month. You can then go and shop on the public marketplace, find a plan. And if you, after figuring in the money that your employer gives you, if you still qualify for additional subsidies, you can really cut down on your costs. And this, makes it a lot easier for employers, because, all of the administration around, their offering group coverage, it simply becomes, kind of deciding how much to give each employee. And then another thing, and there are different things too. So, you can kind of carve out certain populations. You can't do it in a discriminatory way, but let's say you have kind of, people who work in the home office and people who work outside of the home office. Let's say remote workers, for example. You could say, we're going to give an ICHRA to remote workers. We're going to keep our headquarters covered under, our group coverage. The other thing is that you have, companies, well, really with COVID, companies are just like everybody else, are kind of, figuring out what they need to do right now. Delta, just a few days ago, Delta Airlines said that they were going to charge a $200 per month surcharge to employees who don't want to get vaccinated. This is, really a sort of punitive thing. They can do this. They couldn't do this under the ACA, but since they're a self-insured group, they can. And I don't know the actual mechanics of what they're doing. I would hope that Delta has lawyers that have said, yeah, this is okay to do. But, the idea is that if even just a couple of people, even just one Delta employee ends up in the ICU after having gotten COVID, and they didn't, and they weren't vaccinated, then it's going to cost Delta, thousands or perhaps even millions of dollars. That's just one. So and plus it kind of, obviously, there's this idea of, what's the morality of getting vaccinated and so on. So, the bottom line is that, I think a lot of companies are going to look at this and say, what are our options? do we still need to be offering health insurance? Does it still make sense for us to offer health insurance? And especially international companies who don't have to deal with this in other countries, that have universal health care. I think they're going to think long and hard, and you might have some lobbying efforts that start shifting to a universal plan. Maybe the irony of Bernie Sanders touting universal healthcare is that corporations are going to become the biggest proponents of it at some point. Now, that's my crystal ball. Don't know if that's going to happen, but who knows?
It's funny you said that, because I was actually wondering as you were talking if this could be a good hybrid to the two worlds, because some people are so firmly in the camp of, no, we absolutely need employer coverage, and here are all these reasons. Mm-hmm. And yet there are other people that say, no, we need to have the universal health care. This is crazy. But it seems like the ACA really could walk that line pretty nicely. It allows people the options. They feel like they're able to still have choice, but it's also giving everybody hopefully an equitable chance. Does that seem like an accurate assessment?
Definitely. I think it all comes down to risk. Somebody told me this years ago, and it's sort of stuck in my mind. What you're seeing now, 12 million people on ACA coverage, 2 million people coming in, off, during the off season or in a special enrollment period. All those people help level out the risk. So it's not just that you have the people who can't get coverage anywhere else who are coming into the marketplace. You're getting people who maybe are, fit as a fiddle that just got laid off because they were in the service industry, So if you have risk, positive or a good risk profile where insurers can make money, and they want to join the marketplace because they don't want to leave any markets untouched, or any profitable markets untouched, then that makes it really appealing. Once it becomes appealing, I guarantee you that the first employer who walks into a company and says, hey, my friend just got coverage for $40, and I'm a family of four, and I have to pay $1,500 for my insurance because you only cover me, and I have to pay 100% for my dependents. The employer is going to be like, well, what the heck are we doing here? So yeah, I think it really levels it off. The other big thing is that I think that we've kind of, knock on wood or whatever this desk is, you don't know if the ACA, there was also always this uncertainty that the ACA was going to be, repealed or somehow just kind of hobbled. That seems to have passed now, and who knows, it may change, but the conversation really seems to have shifted. And so I think that people, Washington, Capitol Hill is more inclined to do things and pass bills that, potentially could get bipartisan support, or at least they could get something through that could kind of shift things. I mean, the ARPA is a perfect example. That was the first thing in, years that was sort of improving upon what a lot of us thought was, a downside or a problem with the ACA by offering anybody, incentives or subsidies. So yeah, I think, who knows what's going to happen. Nothing ever seems to move too quickly with health insurance, but man, if there was ever a moment that things should move more quickly, I think we're living in it.
And the fact that we've survived this long, maybe I think as I'm listening to you, Shan, it feels like we don't really know where it's going, but the longer it survives, and the longer it becomes ingrained, and then, becomes part of the system and part of the expectations, hopefully, yeah. And, helps with some of the politics. Is that how you're thinking about it as well?
Yeah, it's tough so when I, 10 years ago, I studied political science. And so, I kind of get slowness of the machine. But I also, when I got out of school, I kind of very quickly got into technology, and everything was moving really fast. And so I got into, when I first started looking at the ACA, I tended to think, I tend to decide with the most optimistic viewpoints on it, and think this is really going to shift things, and that's great. I underestimated the sort of embedded stakeholders, so to speak, and they will continue to slow it down. But even there, I've seen brokers who were absolutely, and may still sort of be, kind of politically opposed to the Affordable Care Act, who are absolutely talking about ICHRA. And the ICHRA was it was a Trump Republican policy or regulation. So you've actually seen some people on the left who are like, ICHRAs are bad, but maybe they're not. I always hope that people will be rational, but barring rationality, I hope that the people who want it to happen won't stop it from happening just because of the people who are helping.
I was just thinking, the safety net that you were describing, this is the reason why you need it, because there's just tension all around, and there's, unfortunately, in that the system, the people can suffer, and that's why you have something like the ACA. And so maybe it's holding just because there's just enough dynamic opposing forces. So, taking it from the political maybe to a little bit more philosophical, but one question I did have, which I guess I've never really quite figured out, is where are the physicians in all of this? Sometimes on the physician side, you hear there are people that don't want to take Medicaid patients or Medicare patients because they don't pay well enough, and they'd much rather have commercial. Where do the physicians actually stand on patients that are coming to them through the marketplace? Is that a factor at all?
Well, first off, that's a very good question, and I would really love for you to answer that as a health professional, because I've wondered the same thing. But from a sort of dollars and cents perspective, the people who have ACA coverage, that is essentially it's real insurance. It's just subsidized. The premium is subsidized, and some of the costs are subsidized. So I don't think that there should be objection to that. It's not it's not Medicare where there's sort of benchmark pricing and that kind of stuff. That's obviously a very important issue, but yeah, it's just regular insurance. So I go to the same doctor that I've had for a decade. My kids go to the same doctor that they've had since they were born. It's all essentially the same.
Flipping from the physician perspective back to the patient. So final question for me. When people are going to the exchange, maybe it's their first time and they might have this perception of, oh my gosh, it's going to be lesser coverage or it's going to be whatever. What would you tell them? Because you've experienced this directly yourself and you said that it actually has been better. So aside from the benefit of getting a lower price on the premium itself, what about the coverage? What can they expect to experience?
Yeah, so what you're going to experience probably first is you're going to be really shocked by the deductibles. They're really high, and that's one of the downsides of it.
What's high? What are we talking? Where are we starting?
$10,000 to $20,000. But here's the thing. And I did this math. I'll send you this link if anybody wants to read it, because I did all the math when I did it. Unlike a high deductible health plan, these are plans with high deductibles, but they also allow for, because of the rules of the ACA, they allow for copays. They have other things that are sort of pre-deductible coverage. You get, a well visit. Your sort of annual well visit is covered. A lot of other things. If you have a baby, there are a lot of, there's a lot of additional coverage. They're called, what are they called? Essential health benefits, EHB. And there's a list of about 10 of them that have to be provided, before the deductible is met. So what you want to do is you want to get your pencil and paper out, or your spreadsheet, or, however you choose to do it, and kind of add things up. For me, I've got more data because I've got a big family. I've got 2 kids. I've got a niece and a nephew who are on my coverage. This copay alone is going to save me probably about $5,000, over my high deductible health plan that I had at my last company. That's a little high. I think it was more like $2,500. But so that's one thing. The deductible is going to be huge, and you're not going to be happy about that, because we've been programmed to say, as soon as you see a high deductible, it's crap, but you have to look at the other details. The other thing is your coverage. You absolutely, and luckily the healthcare.gov and great sites like Well and Health Sherpa, there are third-party sites that are doing this as well. They provide you with decision support tools, as they're called. So they will tell you, what your eligibility is up front. You'll have to prove it down the line, but they will tell you what your eligibility for subsidies is up front, and you want to shop with that. Don't get sticker shock. If something says $2,000, you need to look at what your subsidy is. The third, and there are tons, but the final thing that I'll mention is, the other thing about the decision support tools is that you can, in most cases, type in your doctor's name and your prescriptions and see if they're covered and so on, so you can shop around. The third and final thing is that you just want to kind of try to take a look at apples to apples as much as you can. You just, like, if you had old coverage, you may have sort of thought that it was, good, but there's this thing that we talked about a lot in user experience design called status quo bias, where we automatically think that something is good just because we've already had it. So you have to kind of be open-minded and say, was it really good? And is this really bad? Or do I just need to go for it? And I think in some cases you just need to go for
it. So I'm violating the rules because because Stephanie already said final question, and I'm trying to sneak in with another one.
No worries.
But for me, it's an eye-opening conversation because it's not my space at all. So I'm learning a lot. And on the point you were just making, that's why I felt compelled to maybe ask on behalf of the audience who might be listening, is $10,000, $20,000 deductible feels like a lot. It's a gasp of air for most people. But then you said, sit down, sharpen your pencils, do the math, figure it out. There's a lot of essential health benefits that are covered anyway. At the end of the day, when you went through this process, you did the math and you figured it out. When you actually signed up for the plan, did you wind up changing your health behavior as a result of the difference in coverage? Did you feel that there were things that you were no longer getting access to or deferring because of the deductibles? Or ultimately, did you do the analysis well enough to know that I know exactly how I'm going to consume this, and that's how it played out?
Probably yes. We definitely sort of said to people, be careful. And, full disclosure, we had a situation where, we had a semi-emergency, and there was some choices that were made that I was kind of looking at and saying, oh, can't do that. And, it ended up costing us a little more than it should have. I think that, again, I don't like, I think that far too often we want to be regular marketers and spark joy with decisions and so on. And I try to remind people that getting health insurance is, it's not, buying a car or, anything, a computer, anything like that, where you are going to get this certain kind of endorphins going and so on. Getting health insurance is you're doing your taxes. It's a necessary thing. And you do have to think about your behavior, And you do need to think about your health, and we should all be thinking about our health anyway. You do need to think about, in this current climate, about being vaccinated or not being vaccinated. There are so many decisions that you do have to, look into. But the bottom line is that there is never going to be a situation you can have employer-based coverage and still have massive medical bills. So you basically just have to, like I said, you kind of have to go for it. And on the flip side, I say it shouldn't spark joy, but I know from people that are in this business that every day they are enrolling people who have not had health insurance, or who have just kind of come up the scale from Medicaid to buying their own insurance, and they feel so empowered. So I think that I guess my parting shot would be these are very personal decisions, but it's for the greater good. Your having insurance has an effect, or not having insurance has an effect on everybody. And so I think that's one thing that's super interesting to me about the individual market in particular, but insurance in general, is that we have this huge, system, healthcare system in the United States. It could be the most complex public-private hybrid system the world has ever seen. And we all need to do what we can to be, good stewards of it,
I love that. I could sit here and talk to you until, another 3 hours, but I'm sure you have to move on with your day, as we do. And so we're going to end this, but oh my gosh, this was so fascinating. I really, really, really appreciate all your insights. And I think you provided so much information to our viewers that I'm sure they are not familiar with. And now they're going to have a lot of researching, or you're going to be getting a lot of email. So thank you for being here.
Well, thank you so much, Stephanie and Apoorv. I loved it. And I could talk all day too. Maybe we'll have to do it again sometime.
Absolutely. We'll talk to you soon.
All right.
Thank you all for watching. Bye-bye.
Bye-bye.